So why is the patient experience so important to healthcare providers as we head into 2017? It's really quite simple. Since 2010, patient out-of-pocket has grown from $300 billion to $650 billion. And as patients are taking on more financial responsibility, they're demanding experiences like they have in other aspects of their life. You think about Kelley Blue Book and buying a car. You know everything you need to know about cost and quality. You think about Amazon, same-day delivery. You think about Zillow and the ability to search for an apartment. That's the type of experience that patients want. Needing to wait 4 days to get an MRI authorized, only to show up for your office visit and fill out a bunch of paperwork. Then you get your MRI and leave and have no idea what your financial responsibility is. And then you get a stack of statements and EOBs in the mail 20 days later and can't comprehend them. That's an unacceptable experience to the new consumer with this much higher financial responsibility. So what do providers need to drive that patient experience? They need tools that allow them to understand exactly what the patient owes and their ability to pay for it, and tools that allow them to give patients options and how and when they're going to pay. And that's what Availity does with its pre-service clearance and authorization solution. We actually do 30 transactions before the patient even comes in for their office visit, hitting hundreds of databases to determine everything we need to know, the patient needs to know, and the provider needs to know about their financial responsibility. Furthermore, we give them the tools to collect that, whether it's before the patient comes in or when they're there, and we give that person that's responsible for collecting the money the tools they need to ask for the patient's responsibility, which isn't always easy to do if you think about a small community and people knowing each other and having to have that financial conversation. We give that person the tools they need to manage that financial responsibility. Ultimately, that patient leaves understanding what they owe, understanding how they're going to pay it, when they're going to pay it, and really driving that patient experience.